New data from the CDC finds wearing 2 masks instead of 1 offers significantly better protection from COVID-19. Todd just told us about it. But here to dig deeper into that is Dr. Daniel Korytskas, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
So this new federal guidance, it sounds like common sense, but what do the numbers show? Should we start wearing 2 masks?
Well, we know that masks are better at protecting those around us than they are protecting us ourselves, and that fit is crucial. If you wear a double mask, then you can get to about 85% protection. That's the same as if both you and other people are wearing a mask, and that seems to work pretty well in most other countries. But since not everyone else is wearing a mask, a double mask might make sense in some situations.
You talked about fit there. The CDC looking at the benefit of knotting a mask, where you kind of fold the edges, you knot the ear loops so it really flattens, gets rid of any gaps. Is that something that you would recommend?
You know, knotting is trickier than it looks. I tried it myself, and it's not so easy to get those knots in the right place. I double mask instead.
So maybe try the double mask before the knotting. Okay.
Yeah.
All right. So let's talk about another important protection, vaccines, of course. Governor Baker saying today that he hopes to encourage more people 75 and older to get vaccinated by adding more sites, allowing caregivers to get shots as well. From a public health perspective, what do you think? Are those good moves?
You know, what I think is most important is that we redouble our efforts to ensure that vaccine is getting distributed to those communities that are hardest hit and to those people who are at greatest risk of coming down with severe COVID-19. It's much more important that we vaccinate in a way that's most likely to bring the pandemic to an end than to just arbitrarily increase numbers of people who get vaccines.
All right, let's talk about those who have been vaccinated. Today, the CDC saying that anyone who's fully vaccinated does not have to quarantine after an exposure to someone with COVID-19. Do you think that makes sense, and could there still be a risk of transmission?
I think the data are still out on that. There are some data from some of the vaccine trials suggesting that people have much less virus if they do get infected and are less likely to shed virus. But I would still be a little bit more on the conservative side until we have additional information.
All right, good to know. As always, Dr. Korytskas, thank you for your time and your insight. We really appreciate it.
Very happy to be here.